To prepare a bottle for your baby, you will need to have clean, sterilised bottles, teats and caps. First, clean all the feeding equipment in hot, soapy water using a bottle brush. Sterilise everything with your chosen sterilisation equipment. Clean your hands and your preparation area. When you're ready to prepare the bottles, remove them from the steriliser just before use. Boil 1 litre of fresh cold tap water. Do not use water that's been boiled before. Leave it to cool down for no more than 30 minutes. This is to ensure the hot water is still hot enough to kill any bacteria in the formula powder. Read the packaging carefully and use the amount of water and formula recommended. Adding too much or too little can make your baby sick. Pour the correct amount of water into the sterilised bottle. Using the scoop provided, add the required powder, levelling off each scoop with a clean knife. Mix the formula gently by shaking the bottle side to side. Cool it by holding it under cold running tap until it's cool enough for the baby to drink. To check it is safe to drink, shake a few drops onto your wrist. It should feel lukewarm. Remember to discard any milk left after a feed or if unused within 2 hours. It is safest to prepare a fresh feed each time you need one and give it to your baby as soon as it is cooled to the right temperature. This is because warm milk provides ideal conditions for bacteria to grow, especially at room temperature. To safely store made-up bottles, make up the bottles following the packaging instructions. Place the cool bottles in the back of the fridge. Ensure the temperature of the fridge is 5 degrees or less. Throw away any feeds not used within 24 hours. To warm up refrigerated bottles, place it in a bowl of warm water, making sure the level of the water is below the neck of the bottle. You can use a bottle warmer. Never rewarm a bottle in the microwave as it can cause hot spots that would burn the baby's mouth.
Hi, I'm Ellen, one of the midwives on the postnatal ward. Following an hour or so on labour ward after the birth of your baby, you will be transferred here to the postnatal ward where you will begin to get to know your baby. Your midwife will do daily checks on you and your newborn, and they will support you feeding your baby and will give you any medication that you need, such as pain relief. Your partner can come in between 8 AM and 9 PM. Currently, no other visitors or children are permitted to visit, but please ask your midwife as visiting policies are continuously updated. On the postnatal ward, we aim to provide individualised care and education so you are prepared for the initial postnatal period. We will complete discharge planning with you so you feel safe and comfortable going home with your baby. We will demonstrate baby bathing, feeding and safe sleep with you, as well as any individual needs that may arise. Your baby will have a paediatric check and hearing check before discharge. If there is anything that you need or have any questions, please be sure to ask your midwife or the healthcare attendant.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk.
Bath time is a chance for you and your baby to have fun, play, interact and bond. A bath twice a week is plenty to keep your baby clean. You can top and tail on the days you're not bathing. You can bath your baby in the main bath or in the sink or in their own small baby bath. When bathing your baby, get the room ready and warm before you start. Babies can get cold quickly. Close the windows to prevent a draft. Gather everything you need before you start the bath. Towels, cotton wool, clean nappy and clothes, because once you start, you never leave your baby unattended, even for a second. Put the cold water in the basin or bath first, then put the warm water in. Finally, put cold water in again to make sure the taps are cool and will not burn your baby. Fill the basin, bath or sink until it has 8 cm to 10 cm or so of water in it. The water should be just high enough to cover your baby's tummy. Make sure the bath water is the right temperature, about 36 degrees. Always check the temperature of the bath water with your elbow. Your hands are not sensitive enough. Mix the water well to ensure there are no hot spots. Undress your baby, leaving their nappy on. Wrap them in a towel. Hold your baby's head over the basin and wash their hair with water. Do not use any soap, shampoo or products when they're very young. Wipe gently around your baby's eyes, from inner eye outwards. Use a fresh piece of cotton wool for each eye so you don't transfer any stickiness or infection. Wash the rest of your baby's face and neck in the same way and dry them gently with a towel. Lie the baby down, drying their hair and face fully. Remove their nappy. Lift your baby into the water with one arm behind their shoulders and neck, holding their outside arm with your hand. Place your other hand under their bottom. Lower your baby slowly into the bath so they do not feel as though they are falling. When their bottom is resting on the floor, you can free that hand to wash them. Use your other hand to keep your baby's head out of the water. Wash the baby gently and allow them to enjoy the water for a few minutes. After you've bathed them, slip your free arm back under their bottom. Hold their legs with the arm as they will be slippery, and lift them out onto a towel. Pat them dry and do not forget their skin folds and creases. These areas can get sore if not dried well. Babies under the age of 1 are at the greatest risk of drowning in the bath. Drowning can happen very quickly without any noise. It can happen in a very small amount of water. You do not need to bath your baby daily. You do need to clean their eyes, cord and privates twice daily or more if required. To clean their eyes, use cool boiled water and cotton wool. Wipe gently from inner eye outwards. Use a fresh piece of cotton wool for each eye so you don't transfer any stickiness or infection. Babies' tear ducts are very underdeveloped, so daily cleaning is essential. The cord is clamped at birth, and you clean the cord with cotton wool and water and pat dry. The stump is dead and it doesn't hurt the baby. It will fall off between 7 to 14 days. If you are concerned about offensive smell or ooze from the site, please see your GP. At every nappy change, the baby's genitals should be cleaned and dried. For baby girls, clean from front to back to not introduce stool to the vagina. For little boys, ensure you clean under the penis and scrotum. Don't push back the foreskin. Remember to point the penis down into the nappy. Clean baby's bum with cool boiled water and pat dry with cotton wool. Meconium is passed by the baby for the first day or so and is like black tar. The next stage is green poo for another day or two, which changes to yellow seedy poo. Young babies may need changing 10 to 12 times a day. Nappy free time is a lovely opportunity for your baby to have air circulate and help prevent nappy rash. Your baby might have plagiocephaly, sometimes known as flathead syndrome, if the side or the back of their head appears flat. This happens because your baby's head is soft and can easily change shape. Usually, any flattening can be stopped quickly if you encourage your baby to stop preferring one position or direction. For example, your baby might prefer sleeping on their right or looking in one direction. You can help avoid flathead syndrome by having daily tummy time with your baby. Start with several times a day for a few minutes and build up over time. Turn your baby's head while they're asleep and turn your baby's cot so they look in the opposite direction to see you. Please contact your GP if concerned. In your transition to motherhood, it is easy in the excitement to forget about your own health. But remember, your body is healing, so it is important to ensure you are getting as much rest and nutrition as possible. Look after yourself. We would encourage you to have a well-balanced and nutritious diet. Take a postpartum vitamin. Remember to continue your iron supplements. Drink plenty of fluids to keep yourself hydrated and to prevent constipation. Every woman bleeds after birth. This loss is called lochia. Bleeding is heavy and bright red for the first 2 to 3 days and will get lighter in colour and usually stops 2 to 3 weeks postpartum. If the bleeding becomes very heavy or foul smelling, you need to speak to your GP or contact the maternity unit. If you have torn the perineum, the area around the vaginal opening, or have had an episiotomy and stitches, you are bound to feel sore and uncomfortable for the first few days. Make sure you take your medication to relieve the soreness. If you've had stitches, these take about 2 weeks to dissolve. Clean the area after going to the toilet. Avoid constipation and drink plenty of fluids in order to keep your urine dilute and reduce the stinging. Move your body gently every day with either deep breathing exercises or a gentle walk outside. Get back to your pelvic floor exercises as soon as you feel up to it. Prioritize sleep and rest. Household chores and accommodating visitors is not a priority. Be gentle with yourself as you learn about your baby. Acknowledge if you are struggling and seek support when needed. Following discharge, if you are feeling unwell, having aches and pains, a sore throat, any foul-smelling discharge or worsening pain, it is important to contact your GP or maternity unit as you may have an infection. Please consider filling out the HSE post-birth wellbeing plan. Under the infant and maternity scheme, you will have a GP visit 2 and 6 weeks after birth. At the 2-week check, the GP will check your baby from head to toe. If you have any concerns at this stage, please talk with a doctor. At the 6-week check, the GP will check your baby again and check you too. This is a great opportunity to get a breast check, ensure you're up to date with your cervical smear, discuss your mental health, talk about contraception options, and check your perineum or abdominal wound is healing properly.
My name is Audrey Smith and I'm a clinical specialist physiotherapist in women's health here in the Midlands Regional Hospital, Portlaoise. Physiotherapy plays an important role in the postnatal period after having a baby, as sometimes complications of birth can occur. We can support mothers in their recovery after having a vaginal delivery or having a baby via C-section. Advice regarding posture, movement, tips for bladder and bowel voiding are issued. Back care and early exercises to do are advised along with progression of exercise in your early postnatal period. If you are having any concerns regarding low back pain, pelvic pain, bladder or bowel issues or tummy muscle issues, you can get referred into our service for a physiotherapy assessment. This can include undergoing an internal exam to assess your pelvic floor muscles if you are having problems with bladder or bowel or experiencing pelvic pain. We are here to support mothers with any physical issues after giving birth.
We are currently running a Healthy Bodies After Birth class that is available to any person who has given birth within Portlaoise Hospital, regardless of whether you've had a C-section or a vaginal delivery. It is an in-person class led by a senior physiotherapist in pelvic health. In the class, we give you lots of advice on recovering physically after having a baby. This includes advice on exercises to help strengthen your back, your pelvic floor muscles and your tummy muscles. We talk about returning to exercises and day-to-day activities post-birth. We also discuss potential bowel and bladder issues that can arise after pregnancy and delivery, as well as returning to sexual activity. You may have received information about this class in your antenatal classes or on the postnatal ward. Alternatively, you can call the physiotherapy department in the hospital and they will assist you in booking into the class. You can begin gentle scar massage in around 6 weeks post-delivery once your scar has fully healed and there is no more scabbing on the scar. Massaging your scar can help increase tissue mobility and elasticity, decrease muscle restriction and decrease scar sensitivity. You can use a gentle oil, for example a coconut oil or vitamin E oil, to massage your skin and scar area. Initially, the scar may be tender and red and it may be best to work around the actual scar itself, working the tissues both above and below the scar. Gentle circular motions on the skin around your scar can help desensitize the area and get the area used to the feeling of touch again. You can move the skin above and below your scar in an up, down, side to side and in circular motions. As you feel ready, you can then start on the scar. For some people, this may take a few weeks of working the skin around the scar area. For others, they may feel ready much earlier. When you feel ready, place your fingertips on the scar and gently move the scar up, down, from side to side and bring in some circular movements. Start at one end of the scar and work your way across its entire length. To begin with, you are focusing on touch and reconnecting with this part of your body. As this feels easier, you can sink down into the tissues a little more and repeat the same movements. Aim to spend 5 minutes each day massaging your scar until the skin is moving freely and no longer sensitive to touch.
For new moms, contraception may be the last thing you are thinking about, but it is possible to get pregnant soon after you've given birth. Even if you're breastfeeding and your menstrual cycle has not returned to normal. Your midwife will ask you about your contraception plans soon after you have had your baby, and you can also discuss this with your health nurse or GP. If you are sexually active after having your baby, you should be using contraception, unless you are keen to get pregnant again. Emergency contraception is a backup contraception that can be used to avoid an unplanned pregnancy after you have had sex without using contraception, or if your method of contraception has failed. For example, if the condom slipped or you missed a pill. You can use emergency contraception up to 5 days after having unprotected sex. You do not need a prescription for emergency contraception. You can get this directly from your pharmacist. Discuss with your GP or pharmacist, or for more information, visit www.sexualwellbeing.ie.